Welcome to Care Beyond Code, the show from VBA where we talk about the strategies and decisions helping to inject a little more humanity into healthcare today, showcasing those examples where we show care above and beyond the call of whatever the code tells us to do. And today my guest is Todd Archer, the president of Concierge. Todd, thanks very much for joining me today.
Glad to be here, Adam. Thanks.
And today we're specifically going to talk about how technology not only is helping to automate processes and sort of take humans out of the picture while increasing the care and potential care that they can receive, marked most notably by a story where somebody in dire need of medical care facing a staggering $80,000 bill was reduced to a bill of zero thanks to the care of the healthcare admin world. But before we get into that, I don't want to tease that too much more. Todd, would you please tell us a little bit more about yourself and about Concierge?
Sure. So, Todd Archer, I have been in the TPA space for about 35 years, been in the self-funded space for over 40. I started out in the stop-loss side and then moved over to the TPA side and have been with Concierge now for almost 3 years. Concierge actually is a regeneration of a TPA that I acquired back in 2007 when I owned a TPA, and got to know the owners very well through that process, and so I came and joined them about 3 years ago as president. So we actually operate in kind of a cottage part of the industry. We're a little different in kind of a niche market where we serve the people that traditionally have not had access to any type of benefits from their employer, and it's been a rewarding experience.
So to speak to that a little bit, a significant portion of your business serves members in limited benefit plans. So when we talk about care at all, as you just said, these are folks who typically have not had much care. What does it mean to them when anything outside of the expected happens in a medical sense?
Yeah. So, at the end of the day, a lot of these people are working for companies that traditionally have not provided benefits to people that are in the types of jobs that they hold. They typically tend to be on the lower scale of the pay ranges. And benefits that were just either not offered or were not affordable. And obviously when you have people that are in that position, even what would be considered more of a routine medical bill for a lot of us tends to be a little bit of a catastrophic financial issue for them. A lot of them either don't qualify or don't know that they qualify for some of the public assistance that's available. And so our ability to provide them with at least some level of coverage, even though it doesn't cover, more of the catastrophic things, we cover a lot of the things that can still be a drain on their day-to-day budgets. And then obviously there's public assistance that can assist them with access to those resources, and in a lot of cases will help them identify and steer them toward those resources when they're needed.
So help me to understand the code side of this a little bit more, the traditional ways in which a TPA might operate. When somebody who is either not covered or on a limited benefit plan incurs this unexpected, perhaps serious medical expense, what does the TPA typically do? I mean, what are they meant to do when a large cost is incurred under something which is not covered?
So, obviously, if they are not eligible for benefits under the plan, obviously they file a claim that's going to be denied, right? That's just that's the way the business works. So, one, they've got to be eligible for the coverage. They've got to purchase the coverage from their employer in order to have access to the benefits. If they're not in a class that qualifies, because either they're, they don't work enough hours, whatever the case may be, they don't meet the eligibility requirements of the plan, then they're not going to have any benefits. In a lot of cases, the price that the employer has to charge the employee for the coverage is not really something that's sustainable for them. And so they oftentimes will not take it, in which case they're kind of left to fend for themselves in that regard. And then oftentimes, if they do, they're all able to afford it because of the increasing cost of care. Uh, the deductibles get to be are significant dollar amounts now, and it creates a unique challenge for them all oftentimes in their ability to afford not only the premium, but the deductibles and the cost sharing mechanisms that typically occur in a traditional medical plan. And that's where these limited benefits come in, is we're able to offer, even though they're limited benefits, we're able to offer limited benefits, but we're able to offer them at a lower price point with very little involvement from them in the way of deductibles and copays on those expenses. And then we try to identify other ways we can help them with things that are not covered by the plan.
And in part, it's that search for other resources which helps to institute the care behind today's story. So thank you for helping set the foundation for us here and folks that don't have coverage or under limited benefit plans. It seems clear that when something unexpected happens, either they're not covered and the claim is denied, or they haven't been able to afford it, and something else needs to happen in order to make that care possible. So set the stage for this story for us. My understanding is it begins with somebody who works with their hands, has an injury to their hands, and is facing a large medical bill. But could you help paint this picture for us a little bit as you experienced it, because you experienced it firsthand?
Sure. So, going back, obviously, as I mentioned, the plans that we offer are limited benefits, which typically means they don't really cover catastrophic claims, and in a more real practical sense, that's really facility charges. So basically, uh, inpatient, if they have to go in the hospital for care, typically not covered by these limited benefit plans. But that doesn't mean that one of these members does not have a need to go into the hospital for certain things, right? And at the end of the day, in our quest to be able to provide a base level of benefits, we've we looked for ways that we could assist a member, even though it's not covered by the plan. How can we help this member or these members deal with that event where they have to go in the hospital, but it's not being covered? And we became aware of a company, a point solution, that offered two things that were ideal for the members in the space that we serve. The first thing was a hospital bill review. So they will actually look at the hospital bill, and even though we're not paying for the services, they're not covered by our plan. That still doesn't mean if the member owes it that someone shouldn't be looking at that bill to make sure that the bill is appropriate for the service that was rendered. There's no upcoding, unbundling, all the stuff that you can see in provider billings that are billing practices that we should be correcting for the member. And then the second part is what's called 501R. And so 501R is the Internal Revenue Code that governs the indigent care that nonprofit hospitals have to follow in order to attain and keep their nonprofit status. And basically that means a nonprofit hospital has to provide free or discounted care to low-income individuals. When you hear indigent care, the natural reaction is you're thinking, homeless people. Well, most of these 501R start at about 400% of the federal poverty level, which for a family of four is roughly $100,000. Well, a lot of the people that we serve certainly make quite a bit less than that from a household income perspective. We help them pre-qualify. Obviously, the nonprofit hospitals don't really promote that because then they're not able to charge or they're not able to collect what they want to collect from a billing perspective. And so oftentimes they're either unaware that those benefits are available. And even if they're aware of it, uh, the process is daunting enough that someone who really doesn't understand the business end of healthcare is going to say, yeah, I don't think I can do that. I'm not sure I can even provide them what they're asking me to provide in order to accomplish the goal of getting the free or discounted care. And so this technology actually will help the member answer a couple of real basic questions. What is your household income and how many people live in your home? And if they answer those questions, they can pre-screen them and say, yes, you will qualify for either free or discounted care. And then once that decision is made, the member is contacted, and we walk them through the process of here's how you're able to obtain this free or discounted care. Obviously, if they qualify, you got to prove they qualify. So we're talking about copies of tax returns. We're talking about, copies of pay stubs. There is a process, and each hospital, honestly, is a little different. Their process for qualifying for this 501 or free or discounted care. But we will walk them through the process and then get a determination from the facility. And in this particular case that you mentioned, we had a member that needed some wrist surgery. And obviously he's a laborer, so he needs his hands. And so that was going to be a real issue for him because he had to have this done in order to even continue to work and earn a living. And so he had to have the surgery done. The bill was roughly about $80,000 when it was all said and done. And, this is basically a minimum wage worker with really no way to afford that kind of bill. And so we were able to run him through the process. He did qualify for free care, so he met that threshold, and he got free care, and the hospital wound up writing out the entire $80,000. So this man went from a potential medical debt of $80,000 to not owing anything, and it was strictly due to the technological advances that have occurred in the market that's allowed us to be able to help him access these resources that have always been available, but they've been so difficult to access.
So my first question about this might have already been answered by the fact that this was a somewhat automated process. The question being, what is that conversation like when you discover that somebody might qualify for help, even though they incur costs which are unexpected and uncovered by what you traditionally provide?
Yeah. So, obviously, at the end of the day, the member, we're there to serve the member. And so, but typically, even though those bills are not covered, they've got an ID card that's got our name and mailing address stuff. So we're going to get a bill, even though it's not covered, right? And so so job one obviously is identifying, okay, this member has incurred a hospital bill, and then is it in a nonprofit facility? Obviously, to the extent we can steer them to a nonprofit facility, if they call to try to pre-cert the thing, and the member's willing to have that conversation with us, we will certainly try to steer them to a nonprofit facility. But if we get a bill and it is from a nonprofit facility, then there's an outreach to the member that says, hey, can you answer a couple of questions for us? And when and then we ask them, obviously, if the member is not willing to share their household income or how many people are in their household, there's really not a lot we can do except do the hospital bill review and tell them, hey, here it is. But most people, if you're sitting there going, you may be eligible for free or discounted care from this hospital, so you may not owe this bill after all. Most of those hospital bills are of a significant dollar amount that they're going to be willing to have that conversation with you to explore that possibility of saving all or at least some portion of that bill.
So, you've talked a little bit about how technology can help make this process really efficient, not only in maybe helping steer somebody to a facility which is covered under this 501R code, but who also to also help that person fill out the necessary paperwork and certifications regarding sort of the picture of their economic health. So, not to speak to this particular case, but how easy does this technology make that process compared to a sort of technology less world? I mean, would you say, is it fair to say that it takes that from practically impossible to probable, given the fact that somebody who might not even know about that code is not only made aware of it, but then is given the tools to go through with it?
A lot of that depends on what information is actually in the the electronic medical records at the facility. Uh, through technology has enabled a lot of the communication between providers and payers through the use of electronic medical records. When we think of electronic medical records, we just think of, CPT code, diagnosis codes, but they also capture a lot of other information that typically would not be shared with a payer. That the technology has created this link between the what the provider knows and what the payer has access to. And this technology accesses those electronic medical records through the platforms that the facilities use to track those kind of things, and to collect that data on the patient and what they've done in their facility. And the two that drives an interesting dynamic. A lot of the inefficiencies and our inability to deliver a seamless experience to an end user is created by a lack of communication, period, and certainly effective communication between all parties of the process. When you think about a medical claim, the principal parties involved are the member that's actually receiving the treatment for the condition they've got. You have the employer who is setting the plan up. They're arranging for the plan to be administered, and they're funding a sizable portion of that. They often have a consultant or broker that's consulting them on the technical aspects of that plan setup and operation. And then you have the facility that actually generates and is providing the care. Uh, Traditionally, these have been siloed, right? And there's been very little, if any, communication. Most of it was done by, snail mail or, but as technology advanced, it's given us the opportunity to communicate much more effectively between those parties, which is starting to have make a real difference to the experienced end user uh, has when they have to access our healthcare system. Is it perfect? Not by a long shot. Is it on the right track? I think so. And certainly using the tools that somebody like a VBA does, that's using the newer technology to help us communicate better across all these spectrums, certainly puts us in a better position to be able to more effectively um, not only manage the care, but also communicate what's going on to the stakeholders that are involved in the process.
Well, speaking of communication to the member, I have to ask how impactful it was to you and the team when you were able to communicate to, in this case, the patient, hey, that $80,000 bill that you thought was going to be financially crippling has now been reduced to nothing, and you're well back on the way towards healing and making money for your family and get back to work. What was that like?
Yeah, so it was pretty nice, right? And so, so we actually, said, hey, would you like to share your thoughts with us about the experience that you had? Because we wanted to get someone's perspective, particularly someone who had a positive outcome on that. And this was an older gentleman, and you could tell he's a man of few words. But you could tell, that there was, a genuine appreciation for, the work that was done in order to help him with this situation. And again, even though this really was not covered by the plan, it wasn't a benefit, but it was a benefit provided by the employer because they recognized the fact that just because this wasn't covered by the plan didn't mean there wasn't an opportunity here to help their members deal with a potential financial issue around a bill that would be otherwise unaffordable for them.
So let me ask a question that this story and the way in which you got this bill cleared, again, even though it's an uncovered service, brings up to me. It seems obvious to me why a hospital or other provider would not want to actively promote and advertise these things because, of course, they're in business too. And if they can get a bill paid, they're going to get a bill paid for without it being cleared. On
Right.
the other hand, you have an incentive to create the best experience for the member possible, including taking them through the process of getting the bill cleared. So my question becomes, how do you help to operationalize and scale stories like this without creating anything even resembling an adversarial relationship between you and the provider who's ultimately giving up this care for free when they might not want to?
Yeah, and I guess it all boils down to the basic premise and the principles of why they're there to do their job. A lot of them nonprofit hospitals tend to be faith based, um, and at the end of the day, even though they're not for profit. They a lot of them are in very nice buildings that they continue to expand. Now, some of that's, because of the baby boomers, as we age, there's more and more demand for those types of services, right? And so that they're filling a need. Um, but also some of it is, if you got excess funds and you're a non-for-profit, then there's money for capital expenditures and they do that kind of thing. Uh, from my perspective, if their core principle is to take care of people as a faith-based operation and trying to make sure, you know, I personally have not found where they are resistant at all to the technology that allows people that truly qualify for the benefits that they are able to provide as a nonprofit. Part of that being, free or discounted care. Uh, I've not found them to be terribly resistant, and it actually I think a lot of them are grateful that they're working with someone who at least understands the system enough to know here's what we need, here's the way we need it, and we're able to put it together where it makes their job a lot easier. Obviously trying to get that from from an hourly paid worker who maybe is not well versed in how these things work is a bit of a challenge. And so working with someone who's helping them, I think at the end of the day, makes it an easier process for them. Uh, the economics of the thing or the economics of the thing. But at the end of the day, if that's really what's driving them, yeah, then they're going to be a little less reluctant. But by and large, I think most of them are not in that space.
Well, to ask a question, then to turn the conversation towards technology and making sure that things like this happen much more often, taking a look on a 3 to 5 year horizon, I'm going to get buzzy with you here and mention those two letters everybody's talking about today. How does something like an AI or technology focused on that sort of automation, how can that come into play to help make these sorts of bill clearing stories every day as opposed to just extraordinary?
I got to tell you, you know, the rate at which technology is expanding, I'll be honest with you, kind of blows my mind. I have trouble, get my mind around where things could be in that 3 to 5 year. I mean, that sounds like really quick to me, but technology moves at such a fast pace. It's hard for me sometimes to really appreciate and understand it. But what I do know is the key is the ability to communicate to people when they need to know it as close to real time as possible. Okay, because if you think about it, the biggest issue we've had and I'll just use the generic term insurance, right? Nobody really wants insurance. They know they have to have it. They know they need it, but they don't really understand it. And they certainly are not going to go out of their way to study anything until they have a claim and then they need it, right? And so to me, that's where the technology is, the phones that we have in our pockets and what those things can do for us on an on demand, which is exactly what AI is doing, right? Is how do we harness the power of those computers in our pocket to utilize them in an on demand world? And that's where we live in the health insurance space, is an on demand, because they don't want to know anything about it until they need it, and then they want to know exactly what they need to know and not the other stuff that we're required to communicate on a routine basis. And to me, that's the key to the technology, is how do we harness that, but still keep that human to human interaction? Because if you really think about it, aside from a paycheck, benefits are the second most personal thing that an employer provides to their employee. And nobody wants to talk to a computer, right? They want to talk to a real live person when they have a question or a concern. So the key is, how do we harness technology to do those rote processes, to do the background work, to do the research, to pull everything together, so that then when we need to, we can get in touch with the member and say, okay, here's what we're doing. Here's how we're doing it. This is all I need you to do. By the way, pull your phone out. Here we go. Just answer those questions. And so to me, that's the beauty of where we're headed, and how technology can benefit all of us, both from an administrator standpoint, but also from an end user perspective as well.
Well, I appreciate you coming on and telling this specific story of care beyond code. Todd, thanks for letting us in a little bit more on the state of underserved and uncovered care, and how you can even find a little light at the end of what could be a very dark tunnel there. So thanks once again for joining us, and I appreciate hearing from you.
Thank you, Adam. Appreciate it.